I actually created this program or this webinar pretty quickly because I had so many questions coming in about how to position your practice so that you're prepared for what's going on right now, and so that you can also be prepared for the future. And you can help continue to keep your patients engaged and in the process of moving forward with weight loss. So I really named it just 6 ways to effectively manage social distancing with your weight loss patients, and really to minimize confusion and panic, and also to keep your practice moving forward. It's scary times, I know, and we all are experiencing that. For anyone who knows me, my name is Carol Clark. I actually am the administrator for practice here in Virginia, and I also have a consulting business that I spend more time doing that, actually, Weight Loss Practice Builder. And so I wanted to make sure that you kind of knew a little bit about my background. And I wanted to welcome everybody here. Some of you are Bariatric Business Boss members. Some of you I've done consulting with, and some of you may be joining here from some other corporations I've done presentations for, or just have seen things out there in social media. So I wanted to just mention that and welcome everybody, and try to make sure, as you know, your employees, your team, your patients are looking to you in order to keep them calm, keep them out of a sense of panic, and to also, weight loss might not be their primary concern right now, but of course, for you and for your business, you want to make sure that you are helping people stay healthy during this period of time. And there's lots of different things you can be doing to engage your patients right now and keep them moving on in the process. I'm not sure how many people here are from surgical practices or medical practices, or maybe you offer both medical and surgical weight loss. And these strategies actually work whether you're a surgical practice or a medical practice. And I speak firsthand because, as all of this came into play, and we started hearing from some of our patients, one of the great things was we actually have a lot of online resources. So probably, almost a decade ago, we started creating an online membership program and online educational services. We have an online webinar that we've had for years and years, and we've done a lot of online things, not in lieu of what we do in our office, but to augment that and to help provide patients with written materials and video materials, and also that one-on-one consultation. And the great thing about that is that it's prepared us for this sort of situation. And so now I spend a lot of time helping practices do the very same thing. The other thing is, since I'm in the trenches with you, I knew a long time ago that we wanted to have other additional revenue streams in the practice, so that you're not always reliant on one thing. Whether, surgery may be your economic driver for your practice, which is fine, but having other revenue streams in play, from medical weight loss to retail and that sort of thing, can really help expose or keep the viability of your practice going, especially during times like these. So we found that these were really, really helpful. And sometimes people don't implement these 6 different strategies because they think it's too difficult, or they spend so much time trying to make it absolutely perfect that they never really get it out there. They'll spend time creating video or creating webinars, but then I talked to some practices, it's taken a year to get it up on their website, or a year to get it out to people. And I'm going to share with you some techniques on how to get that out, completed and out in a very quick way. And although I do, like I say, consult with practices and help them get this up and running very quickly, I am going to give you the tools that you need in order to work on that, and then always know that I'm available here. And for those people here that are Bariatric Business Boss members, Wednesday we're going to be spending a lot of time of our training on this specifically, and then we'll spend our one-on-one calls actually creating your own webinars and online resources and getting them out there quickly. So what we found is that one of the best ways to continue to reach out to surgical and or medical weight loss clients is through online webinars. And you can do them a variety of different ways. You can actually, some people like to create a webinar and then put it on their website, but require people to opt in and give you their name and email address, which is actually a smart thing, because that way you have their information to follow up with them. It's also great to have that as a resource, because then as you have clients that you're working with or patients, you can actually send them a link to watch a webinar online. There's many times that I talk with physician practices, particularly in health systems, and they don't want to do their webinars online because they're afraid that the patients won't really watch the whole thing, or they will misconstrue the information. And although in person is always best, the way that the communities work nowadays is they like to do things in the comfort of their own home, and this pandemic is actually reinforcing that. And for people who weren't willing to try that, are now trying some of those at home things, whether it's having groceries delivered or whether it's just staying at home more, consuming their information, working from home. And a lot of them are going to find that they do really, in some ways like that convenience. So we've got to be prepared to have these webinars ready to go. So in order to do a webinar, you may already have a surgical webinar that your physician does in person as a seminar on site, and slides are prepared and you do it there, and then someone from the office comes in and talks about the insurance ramifications or the insurance requirements for a patient to move forward. By the same token, you may have a medical program where you do a free consultation, or you do a webinar or a seminar on site where you go through all the different options for your medical programs. These this this resource that you already have created, or if you haven't had it created, I've got templates for it. This resource is something that you can easily get up and running and be able to send to patients and keep them engaged. So you still want to have people looking, even though your practice may be restricted right now from doing elective procedures at your hospital, which is, I know, very detrimental, very scary for you, for your patient, for your practice, for your team. But the key is going to be keeping patients engaged so that as this pandemic starts to settle down and you are able to do cases, you've got plenty of them right there ready to go. So if you have a webinar already created or seminar slides created, what you can do is actually just utilize either a phone, simply videotaping you with the slides behind you, or use a platform such as I'm using here, like Zoom, where you can share your screen and have your slides there, and you can actually then do your presentation and just keep it recorded. This records it right in the software, and then you can just upload it to a YouTube channel and then get the link from your YouTube channel and share that with those people that are still calling your office and interested in weight loss. Because you know what? If people are home, they are searching on the internet for things that they want to work on, and weight is one of those. We want people to continue to be searching on that and to be preparing for when everything sort of settles down. So you want to be out there and readily available. So on your social media channels and that sort of thing, you can even do a live webinar. You can utilize your slides and you can go into Facebook Live. You can actually just create your video in Facebook, through Zoom, on your phone, in YouTube. You can use a platform called Vimeo. There are lots of platforms out there, and this is what I help people kind of work through. But you get your video recorded, and then you post it or you host it somewhere, whether it's on your website, if you're savvy to do that, or you can have your webmaster do that, or you record it, keep it in, like I say, in Vimeo or YouTube. You get that link, and then you have a way to promote it to people out there on the web. And you can actually have them go ahead and watch your webinar that you've now created. If you have a Facebook page, you can do live seminars, live webinars right there, and then have someone from your team right there ready to answer questions, a way for them to email you or secure chat so that you can communicate with them. So I encourage you to, if you don't have a webinar yet, to create a webinar and to host it somewhere where you can get an easy link, and you can actually be sending it out to all those people that are either already in your funnel, that perhaps were scheduled to come in for a seminar, and or those that you're continuing to reach out to keep them engaged and keep them learning about your practice. You want to be in front of them. So for example, tomorrow night we had a seminar scheduled here at the practice. We had about 30 people scheduled to come in. And obviously you don't want groups of people all getting together in this time right now with this pandemic going on. So instead, we reached out to each one of them via email and secure text. We sent a link to our webinar. We then are following up with a phone call to answer insurance questions, and we're getting them started so that you're not waiting for this to pass, you're keeping them engaged throughout that process. I mentioned mostly surgery, but you can do the same thing with medical program. We have a medical webinar too that goes through all the different things that we offer at the practice. So we have all of those medical options for people, and we basically take a free consultation, record it, and we actually share that with people so that they can actually call in. And a lot of our programs you can actually purchase online, or we can get them going right from that webinar. So a webinar is a great tool. And I actually have to say, we've been doing it literally for over 6 years, maybe 8 or more years. We've been doing webinars. It now accounts for close to 40% of the new patients coming through our practice. They actually feel like they know you better. They feel like they already get to know the team because they see the surgeon or the physician on the video. They also then get to talk to someone from your team, and you can set it up in a variety of ways. So anyhow, that's one thing. If you don't have that going for you already, I really encourage you to get that up and running. And for the Barrett to Business Boss or people who want to consult, I do have templates for that, and we can actually walk you right through it. You could get it, you could literally record it today and have it up and running by tomorrow. So I think rather than making it a bigger process or something that has to be absolutely perfectly done by a professional video team, you have the tools with just your iPhone or your computer and an internet link. So webinars is the first way, whether it's surgical or non-surgical, that you can continue to engage your patients and keep your practice moving forward so that as things settle out, you are ready to have patients who are ready to jump in, or keep them going in the current process. The second thing is video or telephone consultations. So we have people who for surgical weight loss have to go through certain nutritional consultations. And so we are actually converting a number of those into video or phone consultations. And this is turned out to be something the patients, we've done a number of them today, and we do them periodically. We have some travel patients, and so we've done that before. We also have some online weight loss programs, which we're going to get to, and we can do some of their consultations via the phone. It's a very common way for people to get their consultation. And with a secure system, whether it's your EMR or whether it's a text system that you have that's secure, you can actually have them message you their weights. They can send you their all their what they've been eating in terms of their journal. They can send you a link to MyFitnessPal, whatever it is that they're using. You can see what it is they're eating, and you can actually have that conversation and guide them through remotely. So on video or phone consultations is another thing during this period of time that helps to decrease your interaction with them, decrease the chance of spread, and really maximize that social distancing that we are all charged with doing. So video or phone consultations is another one. As we go through, if you have questions, you can always put them in the chat, and I will hit on every single question. The next one is secure text messaging. And we have actually, just within the last year, really honed in on secure text messaging, and it has been a true game changer for our patients and for our team. It makes it very easy to communicate with people. Case in point, when we were rescheduling people for tomorrow's seminar, and we also do other services in the office. We had some group classes that were coming up that we have the same class. We always record it as well, so we have that as an option for travel patients or for people. We always want them here for certain classes, but in a situation like this, we had that all created. So our secure messaging was a great way over the weekend to reach out to all those people, send them the webinar there, and we also send an email. We then can follow up with them, make sure that they received that they were able to view it, and to make sure that we were able to accommodate. But the secure text messaging is actually more trusted nowadays with patients. And, you know, I'm always very transparent. We actually use a software called Connect, K-E-N-E-C-T, for our secure messaging. And yet in our retail store, we have a separate text messaging because we've had it in place called Textedly. And that's actually one that they opt in for, and they get discounts on some of our products and that sort of thing. So we have these secure text messaging is the third way that you can help increase the amount of social distancing with your patients. And the thing is, you're social distancing yourself, but you're not alienating them or not communicating with them. That's worse. It's time for us to take control over this. Our patients want us to take control over that and be in communication with them. So that's another resource. So we've talked so far about webinars, online webinars. We've talked a bit about video and phone consultation. We've talked about secure texting. And these are all things that we have found in our experience to be very well received by patients. And it's a great way, like I say, for you to ease, kind of streamline your communication with your patients, and also just make it really easy to make sure that you're communicating back and forth and you're answering their questions. They want information. You are the one who helps guide whether they are nervous and panicked and moving away from your practice, moving away from their idea to have weight loss services. You know, people can come up with all sorts of different reasons why they don't want to continue with a weight loss program. And so the smallest barrier can cause them to fall off. I know as practitioners, you all see this every single day. So it's our job to keep them engaged. It's our job to keep that communication open with them, to stay in front of them, and use this time for something positive. So use this time to keep them moving through their insurance requirements if it's a surgical weight loss program. Use this time to introduce some online programs for those that are seeking medical weight loss program. Use this time to remind them during a high period of stress to make sure that they still are eating in a healthy fashion and that they're getting some sort of fitness. Make sure that they're utilizing that time if they're quarantined at home for additional education, and to also make sure that they are keeping themselves healthy. So secure text messaging is another great way to do that. The fourth thing I'm going to talk about is an e-store. And e-stores are one of those things that are not as easy to create overnight. And it's one of those things. We have a retail store here. We have a great team here, and we have a great retail sales manager. And so each month we have been growing this over the last, 10 to 15 years. So it used to be our retail store would bring in about $15,000 a month gross revenue. It now brings in about 35 to 40 gross revenue per month. Now, granted, half of that goes to the actual product, and then you've got some other overhead expenses, but that's still another great revenue stream that doesn't rely specifically on the surgeon or the physician. It's something that helps during these times when we are all unstable in business and when we're having these outside forces that are preventing patients from seeking our services and engaging with us. So that's another way for you to be reaching out. For example, we, over this period of time, it's a great time for patients to stock up on healthy food, healthy, high protein, adequate, with a more of a lower carbohydrate count. They can actually order online, pick it up here. We'll actually bring it out to them, or they can come in the store, but it's all paid for. It's all done ahead of time. We can run specials for them to help keep them on track. We use that also as a way to help share recipes and communication with them about different products and how to use them in a very unique way, making sure that the products are unique to physicians, something that they can't just get anywhere out there. Also making sure they are the highest quality and that they also taste great. If you haven't been to my website, weightlosspracticebuilder.com, I have a resource in there for my favorite retailers and different products and that sort of thing. And in Bariatric Business Boss, I actually have a retail store in a box that you can actually download this document and you can be up and running. It tells you exactly how to package things. It's also a great way to start like a 2-week program where you actually use products and help people either do some of your product during the day with a healthy meal at dinner or all products, or somehow create a plan for them. They actually order it online, they get the product, and they can actually be implementing that during the 2 weeks they're at home. So it could help speed that weight loss up for people who are on medical weight loss programs. It could help prepare those who are waiting for surgical weight loss to actually, lose that weight ahead of time and get them going on track and to be communicating with them. And it also creates an additional revenue stream for your practice during these more difficult times for your patients. And it also creates a whole nother reason for you to be communicating with them. So we spend most of our email messaging and text and our posts, social media posts, we spend most of our time doing education. But at the end of every educational post or in every email, there is a call to action to help them know how to take the next step, to help them know what resources are really readily available for them right now to be implementing. and to help keep those additional revenue streams coming in. And it's not just about that money, it's about having cash flow so that you can then even better serve your clients and have a greater reach. So your patients are buying products from somewhere, so why not have them buying them from your center, where you know that you can control the quality with which what they're purchasing and that sort of thing. So an e-store is another way to increase social distancing, in terms of they can order online, or you can, if you don't have an online version and you just have an on-site store, have, implement some telephone call ordering and take, that sort of thing. You can be very creative, and now is the time for us not to panic, but to be in control, to be communicating with our patients, and to be taking some steps to help ensure the viability of your business. So your e-store is another method. The next one that I wanted to mention, the fifth one, is online patient education. And online patient education is one of those things that is easy to create. I know people make it harder than it has to be. It can be done. I know we do podcasts here. You can take any questions that your patients have, anything that you want to educate them about. We actually put together total curriculums based on what it is that we cover on our medical or surgical weight loss programs. When people come in, what is it that we cover? So it covers things like, emotional eating, how to manage that, eating out, eating in. It covers your macronutrients. What should those percentages look like for your different macronutrients? Your protein and carbohydrate ratios, staying hydrated, getting enough sleep, what it does to your body if you don't get enough of that. So all the things that you are teaching every single day, you turn into shorter video along. We always include a written materials as well, but you can record a quick video with just your phone and a little ring light, or maybe even not, just use your light, whatever you have available, record that, upload it to a YouTube channel that you create, or your Facebook page, or if you're wanting to do it private because you're going to do it as a paid program, then you can create that on any sort of a uh, patient membership site. We use a patient membership site. We even have the whole curriculum already created, and we can actually white label it with your logo and a intro video or intro soundbite from your physician or your dietitian, or however you want to work that. But we build the whole platform for you. But you can do it just as easily yourself. I help people do this every single day. So, and my team is here to help with that. So you can create online education either in a private forum that you can charge for, or just as a way to keep your patients engaged during this whole process when you're trying to continue to work with them in preparation from surgery, or for people who are already in a medical weight loss program and are saying, well, I can't really continue because I can't come to your office. That they don't have to come to your office. You can interact with them and provide that online education. People, are buying programs all the time through Facebook. It could be just somebody who's lost, I'm not going to be, criticizing, but there's people out there who are not the medical professionals that you are, that are offering programs that people are buying up right and left. And they want it because they want it in the privacy of their own home. You can also make it a very favorable cost point for them. And once you create this educational material, it's there forever. So from then on, you build your site, you build how people are going to create it. You actually can create a private Facebook page if you want to be interacting, but you don't have to. And you can actually then have that as sort of what we call an evergreen program, where you can just continue to sell it to your patients. So online patient education is one piece of that, where you're actually creating online patient education through social media, and just through answering questions that people have, keeping them engaged, always having a call to action on how they can continue to work with you. And then my sixth one is, online medical weight loss programs or surgical weight loss programs, such as, even a Back on Track program. That's another program you can easily develop, provide that education, create those videos, create those written PDFs, and you probably already have it in your practice. You just haven't packaged it in a way that's saleable to your patients, or something that could be easily distributed online, especially in times like this when we're experiencing the need for social distancing. So, I work with clients all the time to create these sorts of material. It's easier than you may think. It's also a bit more fun than you think. It's nice putting your personality into your program. and engaging your patients. And there's so many online tools available, not to make it confusing, but I am all about making it simple. So rather than feeling like I have to learn a whole new software system and that sort of thing, you can take, like I say, the resources available right at your fingertips and turn that into a way to communicate with your patients, to keep them engaged, to create programs that you can turn around and sell then to patients, and to also down the road create, I do publishing, so creating, a book that down the road you're going to actually promote and have more media attention for and become the recognized expert in your community. It sets the groundwork for attracting patients from around, in your area, around your area, and even a little bit of, medical tourism, depending on how much you want to get into that. We do some of that, but we're very careful about patient selection because we want to make sure that we're going to ensure their success. Anything that you're creating during this period of time is something that will serve you long term, help you be better prepared for the future. And it's just something that, like I say, is easier than you think. I was getting so many questions about it. I felt compelled to come on here today and just go ahead and review some of those. So real quickly, type in questions if you have them. It looks like we have a great group of people here. And I am going to be, if you want, send me an email, Carol, Karol, at weightlosspracticebuilder.com. If you want to get a PDF with some additional tips that outline what we covered today in this webinar, and I'll be sure to get that out to you. Just make sure you send me an email so that I have that all in one place so that I can send that out to you. I just have to create the link and get those out to you. So we covered a lot of different things. We are in a pandemic. People are nervous. We all are nervous. It's impacting business. It's impacting the care of our patients, our teams, our families that we work with here, and our family of patients. So a couple of things we went over was, first, an online webinar, surgical or non-surgical, that helps you keep your services introduced to people that are searching that out online. And I can guarantee you, people are afraid, but they're home. And many people are home and they are on the internet. So driving some marketing to an online webinar, or gathering the links, or even looking in your database that you have already and sending them links to keep them on track for webinars for medical and or surgical weight loss, is going to be very, very important and very helpful to you, especially for the long term. The second thing we talked about was video or phone consultations. It's much easier to do that if you are in a cash pay situation. There are codes out there for coding that. If someone here has a lot of success with that posted, there are a lot of insurance companies that are not always recognizing that, and the patients don't always realize that they still have a copay for that. So we have found here that if it's a service provided by one of our coaches, it's not a billable service through a registered dietitian or the physician, oftentimes we can actually create a coaching or a way to get that accomplished with at a lower cost than what they'd be paying through their insurance. But there's lots of different ways to do that, and I'm happy to brainstorm that with you. But video or phone consultations is another option. Works really well with cash pay patients, and can be done with insurance patients. It's just a little bit trickier. The next thing is secure text messaging, and that is a way, I don't know how you are, but I get so many emails a day. When I get a text, I always read it. It might be one of my 4 kids. It might be, somebody who, it's just a more secure way of me getting my information. It's a great way to talk about sales in your retail sales store. It's a great way to connect with them, to reschedule or to schedule phone consultations instead of their appointment at the office, or to also, communicate with them about a class, give them a link to a class that you have coming up. I gave you a couple of examples. We just this weekend spent time texting and emailing people, just to do both ways, but text was more effective, quite frankly, to give all of our seminar participants that were scheduled a link to watch a webinar, and then we will be following up with them, and also told them how to reach out to us. We are using it for our pre-op education class. This is the first time we've actually done that, tomorrow, for our whole pre-op education class. We set that up. We're also doing a one-on-one little phone consultation to answer all their questions. We're going to have them just come by the office and do a drive-by to pick up all of their pre-op labs and orders that they have to have done at the hospital before surgery. And they're going to just kind of come in. We have all of our educational materials, which are in a book that we published, that we also include all of their their consent forms. They're going to get all that right there very easily. But it was great to have that class already prepared and recorded, which you could take care of pretty quickly. And I'm happy to help you with that. But we had that all created, and it was a great way to send that out to them. We also had a post-op class that was scheduled for today with about 8 participants that were scheduled. We went ahead and sent them a link to that, and then we are following up with them to answer all their questions and that sort of thing afterwards. So that's a great way, that secure text messaging. An e-store is a great way to add a revenue stream into, or even if you're just not offering retail, it's a great additional revenue stream for times like this. People need to have convenient, high quality food to be eating and products. So they're buying them from somewhere, so it may as well be from you. But having that in place and being able to promote 2-week jumpstart programs, I love creating those and helping people see immediate results. You can combine that with one-on-one coaching, use that as a cash pay option for patients. There's lots of different ways that you can do this. So an e-store is another way to minimize the need for them to actually be coming through your practice. So we're talking about social distancing, but I am talking about things that you can create today that will serve you into the future, will serve you right now to keep your patients engaged, so that when some of this settles down, you will have them all right there ready to go with one of your programs, or buying online and starting their weight loss with you online. The next thing we talked about was online patient education, a great way to continue keeping your practice out there in the forefront, whether it's through Facebook video posts, blogs, podcasts, webinars, just like I'm offering here. You could be having your own, instead of a seminar, do a live webinar on Facebook. You could also, like I say, we talked about recording it. I don't want to beat that anymore, but online patient education, everything you create then has a link, and as you email newsletters and lots of other exciting ways to keep in touch with your patients, you can actually just have links to those newsletters, blogs, videos, recipes. It's a great way to communicate with them and provide them with real resources so that they really see the value of working with your practice. And I'm in the PDF that I send out, it's not only going to have an outline from today, but it's also going to have some of these tips for how to create engaging patient education that can also go 2 ways so that you are staying engaged with them. So online patient education, and then the last thing we talked about was online medical weight loss programs or back on track programs. And those are things that you can create, house in a secure environment. You can actually set it all up to be what we call, like a turnkey, evergreen type of offering, where you can just have it dripping out to the patient, then you're following up with that if you want with one-on-one coaching, which always makes it more effective, I know. So you can do that and be very, very effective and have something that's all online that doesn't require them to come in. So it really honors that social distancing. And we're doing it every day here. It is working. A couple of other just bonus ideas. One was that Back on Track program, and the second one was, I know here we do outpatient weight loss surgery, sleeve gastrectomies. Dr. Clark's done them here now for 10 years, more than 10 years, I think. So anyhow, that also helps because patients aren't in the hospital as long. We educationally prepare them for that. The patients love it. And other than a couple of insurance requirements to spend the night, for the rest of them, it decreases their, it increases their ability to social distance. They do have some time in the hospital, but then they go home. And so there's lots of different things there as well. So let me see what questions we have coming in. Can you share a link to your surgical and medical weight loss webinars, and what do you find the best length of these webinars? Bruce, that is a great question. You can actually see our surgical one. They're actually at our website, cfwls.com, stands for Center for Weight Loss Success. You'll actually see Watch a Webinar. We are one of those kind of outlier practices that don't require people to opt in because we have such a great follow-up system. We find that having them opt in can sometimes be a barrier. People don't want to give their information. Once they see that and they kind of get to know what it is you're about, what you offer, then it makes it a little bit easier easier. We are in the process, actually before this pandemic began, redoing our medical weight loss program because we just modified all of our programs. We did have a lengthy 6-month program. We found people don't want to pay for that length of time, and it's also daunting to them. So we have found that actually 2-week programs and the maximum of 3-month programs is what helps keep people engaged. It lowers the price point, so it's a little bit more feasible. They get to know you, and then you can actually offer ongoing coaching with them. So we are actually in the process of revising that one, but I will, I can, if you email me too, we can do it. But the surgical one you can find right at cfwls.com. That was a great question. Bruce, good to hear from you. And in terms of the length of these webinars, when you get to that surgical one, every surgeon's a little bit different. I actually find that if you can keep it to no longer than 30 minutes, just like here we're at 6:05, what I find is after 30 minutes, people tend to start to, they get their minds get busy, and no matter how engaging that you may be. So we try to keep it to no longer than 30 minutes, and always, always, always have a call to action, a way for them to reach out to you. We actually write on the page, we talk about the criteria for surgery. We actually have them reach out. They can do a secure chat with someone here, or they can sign up for a little telephone consultation. It's just an easy way for them to get all their questions answered. They actually pre-qualify themselves before they come in to the practice, and it just makes it so things move much smoother, and you end up spending less time on patients who either opt out for whatever reason. Maybe they don't have the benefit for surgery. In Virginia, that's a common thing. It's not common in some other states, more like some California or New York or that sort of thing. But it's common here. So we don't want to bring people in and they get all geared up for it and then they're all disappointed. But we do like to bring them in because we have a really reasonable cash pay surgery option. And so oftentimes they'll switch over to that. So I like to try to keep it to no longer than 30 minutes. And for most surgeons, they have a lot of, they want to make sure they get the information. The other question I get oftentimes is, how do I know that they watched the webinar? There is software out there. I know in our private membership site, we can actually track how long that people actually follow a program or a video that you have. You can add a test at the end because people can turn it on and walk away and do their laundry or whatnot. But we also have them come into the office. And if it's for surgery, that's a big deal. We want to make sure that they watch the webinar, and even we do some bioidentical hormone replacement therapy here. We have a webinar for that at Center for Hormone Health and Wellness. We actually have but when they come in the door, they actually have to sign, and we tell them this ahead of time, that they have to sign indicating that they did watch the webinar, because the surgeon wants to spend time talking about them and their particular situation, not necessarily re-evaluating all the surgical options available, although they will if they have to. But it's one of those things that takes a lot of time, and you have a busy schedule to uphold. So that's a great question, Bruce. I hope that answered your question. And I didn't want to go longer than 30 minutes, so I tried to keep everything to about 30 minutes. If you are interested in the PDF that goes through what we talked about today and also adds some additional tips for social media, please send me an email, Carol, Karol, at weightlosspracticebuilder.com. Now is not the time to do nothing. Now is the time to build these systems, to build these resources, to get them out to your patients, to keep them engaged, to have a way for them to actually be interacting with your practice virtually. It's really, really important, and you're going to find that it's going to be an essential skill from here on out, because people are going to try it. They're going to like it. And I know we've been doing it, like I say, literally for almost 10 years. Online webinars accounts for about 40% of our new patients coming through our door. And we work really hard by the time they walk in, they feel like you're their friend. They feel like they know you. They've watched the surgeon so many times in videos. We probably have over 300 videos on our YouTube channel. You can check that out if you go to cfwls.com. C as in Charlie, F as in Frank, WLS as in Sam.com. You can actually click on YouTube. You'll see over 300 videos. They really feel like they kind of know the team and they know the physician before they ever get to the practice. And it also increases that bond between you and that patient. So we want to keep them engaged. We want to quell panic. We want to make sure that we're setting up systems that are going to be repeatable from here on out. And I am here to tell you, I mean, I've been doing this for literally for almost 10 years, and it's easier than you may think. And that's why I felt compelled to come on here, because I was getting so many questions about it, and I want to be of service to you all. And I also would love to have, quite frankly, just be, I'd love to have some, I have a great group in Bariatric Business Boss, which involves lots of free social media calendars every single month that you can deploy. I have tons of free resources, retail store in a box. We've got all sorts of stuff in there, and you can have access to that right away. I do weekly trainings. You get one-on-one time with me. You send me anything you want me to look at, whether it's an email or your website or anything like that. I take a peek at it. I give you my opinion, but it's really, really designed to be really low cost. That's at bariatricbusinessboss.com. I'd love to have you in there. It's probably the easiest way to work together. But I also do, some packages with people to have a set. I do site visits, of course, not so much right now. I just did 3 in California the week before last, and with some great groups out there with a lot of positive things going on, or people come here, but obviously with travel bans and that sort of thing and people not wanting to travel, we can do a lot of that remotely, just like we're doing here. We do face-to-face contact, and we set up systems in your practice. We look at what you have going on right now, how to streamline things, how to add revenue streams. I put my team to work for you, and we can kind of get things up and rolling. So anyhow, that's what I have today. Any other questions from anybody? Anything that I can help answer for you? I will have a link to the program, to this presentation that I can email out along with that PDF. And just go ahead and, like I say, email me, Carol@weightlosspracticebuilder.com, if you want a copy of that. I know a few of you have already emailed me, so I will get that out to you. And if there's no more questions, I just want to thank you for your time and congratulate you on what you're doing, and really encourage all of us we're in this together you know, to make sure that we have our patients' interests at heart, and that we're actually preparing our practices for the future of healthcare and to best meet their needs, as many people are still, believe it or not, searching for weight loss. Now is the time for you to be prepared to meet their needs now, and also to be better prepared for all of us, to be better prepared for the future. And if you have other questions that come up, just email me, like I mentioned, Carol, Karol, at Weight Loss Practice Builder. In the meantime, thank you for all you're doing every single day, and hope you have a good night. Stay healthy, stay safe, and thanks for all you're doing. Take care. Bye.